Welcome to another edition of Capital Preview, brought to you by MediaCom. I'm Bill Peard, and I'll be your host as we discuss important issues with our state representative. Our guest this morning is Lisa Heddens, Democrat from Ames. Welcome, Representative Heddens.
Welcome. Thank you very much for the invitation.
Oh, yeah. We always like to hear what's going on up at the Hill and issues that our representatives and senators have going on. So our first one, I know it's kind of near and dear to you, is managed care. So if you kind of want to explain a little bit about the managed care aspect of your work up at the State House, I'd like to hear it.
Certainly. Well, I am the ranking member of the Health and Human Services budget, and about a year ago, the governor moved to privatize our Medicaid system. Medicaid is for individuals, low-income individuals. About 60% of people in Medicaid are children. About 20% are childless adults. That was part of our Medicaid expansion that we did a couple years ago. And then another 20% are seniors that may be living at home with support services or in the nursing home, and people with disabilities. Again, they may be living in a community setting with supports or in one of our institutional settings. Of that latter part, that 20% of seniors and people with disabilities, again, they make up 19% of the Medicaid population, but they make up close to 79% of the expenditures in Medicaid. Higher acuity, higher medical needs that they incur. So when you're looking at privatizing, I always like to make sure folks know who we're exactly talking about and where the impacts may be the greatest on that. There are other states that have gone to a managed care system. I believe it's about 39 other states that have done that. What's different in Iowa is that the legislature really didn't have a say in the process. It was kind of thrown upon us during the last legislative session. The pace that we're going at it, and that we're basically throwing in the entire Medicaid population and children that are on our Hawkeye program into this new managed care system. Another state that went relatively quickly was Kansas, and they've struggled because of the pace that they went, people no longer receiving services. I believe their Des Moines Register had a newspaper article that there were about 1,200 seniors who were dropped from services, and they can't figure out where they're at. So we want to ensure that we're not following the footsteps of Kansas. We want to make sure that we are doing a smooth transition if this is the direction that we're going to go. People maintain their level of services that they've had, or increase if that's what they're needing, and that they've got a good network of providers to meet their individual needs. Excellent.
So the other thing that I'd like to talk to you a little bit about this morning is the state of our mental health programs in Iowa. It seems like that's a national problem. I think we're seeing it show up in a lot of different ways. I'm not necessarily lumping the shootings or the violent acts that we've had, but it seems like mental health issues kind of are in there somewhere. So I'd kind of like to get your opinion on our mental health state in Iowa right now, and
sure. I mean, and
maybe nationwide.
Sure. There's always areas where we can improve upon. We've heard some tragic stories of shootings in other states, and generally, kind of folks have looked at, well, what's the mental health status of the individual who committed this horrific crime? I certainly don't want to equate that anyone who has a mental health issue with such violence, but there are. Sometimes there are some underlying circumstances.
Right.
So the things we need to look at is, do we have enough professionals within the state? Psychologists, psychiatrists, advanced nurse practitioners who have an understanding in that mental health system, and a whole menagerie of those professionals to be able to help individuals. And also to make sure that they've got those support services in their local community. A few years ago, we went to regionalizing our mental health and disability system with the thought that would be more available services for various counties. I live in Story County, for example, that had really quite a plethora of services, yet Boone County or Hardin County, which borders me, didn't have as much, and it just didn't seem fair to me to say, well, gosh, how can we be more open and wrap ourselves around to help individuals. So that's one good thing that we made some steps into doing. The closure of the 2 mental health institutes, the ones at Clarinda and Mount Pleasant, I think were hastily done. Certainly you want to have folks receive those services within their local community, but you've got to build that up, that capacity up. And by just kind of arbitrarily closing them and not having enough services in the area really puts a challenge on other providers. I spoke with a hospital, for example, who has an individual who was having a serious mental health issue in the hospital. They've been in the hospital for over 96 days. They don't meet the criteria of a mental health need anymore, but there's no provider who can take them on right now. They're to capacity. So that becomes a strain within our system. They probably would have been appropriate candidates for maybe Clarinda or Mount Pleasant, but we don't have that any longer. So you've got a number of folks that are lingering out there, unfortunately.
So does that cause like kind of other ripple effects, that if they can't be treated in a professional mental health facility, that they end up in maybe a homeless shelter? Or
there are some who could certainly end up in a homeless shelter or go to a different provider agency. That we've got some great provider agencies.
Right.
They just may not have the specific training for that level of need. You may have individuals that are sent out of state, which is at a higher cost reimbursement state per diem to the state versus had we maintained the larger facilities and kind of set up a dual system. If you're going to close down Clarinda or Mount Pleasant, then you need to have dual funding to build up the community to a greater capacity to serve those individuals.
Excellent. Well, that very interesting topics and very relevant to our state that we're at right now in Iowa. So I appreciate your time this morning coming in, Representative Heddens. Good luck with the rest of the session. Our guest today has been Representative Lisa Heddens from Ames, and welcome, or please join us for another edition of Capitol Preview.